Alright, so this is Pharmacist Interventions, actually part 12. I kind of lost count in there. But I had a patient who had a newly diagnosed seizure disorder, and she came from the ER and they prescribed Briviact. That medication is $1,500 for a bottle of 60. Of course, it wasn't covered with insurance. It was a Medicaid patient, and ERs don't do PAs. So I recommended that they, unfortunately, either go back to the ER or call the hospital and have that switched to Keppra. And then they did, and then it was covered. Brivaracetam is Briviact, Keppra is levetiracetam. They're in the same drug class. Another intervention I made was I had a patient who was prescribed both carvedilol and metoprolol. He had AFib and heart failure. It's not appropriate to be on 2 beta blockers for that. He didn't know which one he was supposed to be on, so I messaged the doctor and I was like, can you clarify this? Which one are they supposed to be on? I messaged the cardiologist because I'm like, they probably have a specific one that they want the patient to be on. And I was correct. They wanted the patient on metoprolol, which I like better since it's a daily dosing. Another intervention I made is I had a female patient who's having migraines every day, and she's missing work, and the only medication that she was on was as needed Nurtec. So Nurtec is a calcitonin gene-related peptide receptor antagonist. It's one of the newer drugs like Qulipta, Ubrelvy, and it's an oral formulation of basically Aimovig, Emgality, stuff like that, and it's used as mostly treatment therapy, and some patients do use it preventatively. But per guidelines, if you're having more than or equal to 4 migraines a month, it's recommended to be on a prophylactic or preventative therapy, like something like propranolol, topiramate, valproic, something like that. But something that I like to recommend to patients is Emgality and Aimovig and Ajovy, the injectable therapies, they're monthly therapies. And some of them actually you can do 3 injections, it'll last 3 months. But I've had a lot of symptom relief with patients taking those injectable versions. And then the last intervention I want to talk about is I had a Medicaid patient prescribed hydrocortisone acetic acid for otitis externa, which is an outer ear infection. It was $160 and non-formulary for her Medicaid. So I called the hospital and I talked to a pharmacist that was actually working in the ER, and I had them switch it to what I call neopolyhydro, which is cortispor and HC Otic, and that was covered in no copay for that patient, so she was very grateful for that.